I'm going to follow the general principles and safety practices. I'm going to perform hand hygiene, make sure that my patient isn't high fouler's, identify my patient with 2 patient identifiers, check the order for the nasogastric tube, set up my equipment, and verify the expiration dates on my equipment. Perform hand hygiene and put on some gloves. And I'm going to assess or ask the patient which nair is more patent. Take my tubing out of the pack. Well, I'm going to drape my patient first so that it's clean. Make sure they're in high fouler's, and I'm going to be taking my tubing and measuring from the nair to the earlobe. The xiphoid process, I'm going to mark with a marker or a piece of tape where my tube should stop at the nair. I'm going to clean my patient's nose with an alcohol prep pad, and I'm going to apply a skin barrier cream to make sure that there's no skin breakdown from the tape. You want to lubricate your tube 2 to 4 inches so that it goes in easily, and have a cup of water with a straw along the bedside. So they're sitting in high fouler's. I'm going to have them tilt their head back on the pillow, start inserting. If you reach the gag reflex, have them tilt their head down and swallow the water. Swallow, 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 swallow. Once I reach my mark, I'm going to hold on to it and tape it. Now, if they were to start coughing or having difficulty breathing, you may have reached the lung, so then you would need to remove the NG tube completely. Okay, I'm going to take one more piece of tape. And now I'm going to confirm the placement of the tube using this. I'm going to take out the gastric fluid and measure the pH. Follow facility policy on whether or not you should return the fluid back into the patient's stomach or just to dispose of it. The pH should be between 4 and 6. So check the pH before you get an x-ray, but you will always get an x-ray after insertion before performing suction or administering feedings. If using a Salem sump, make sure that the tube is higher than the stomach. And then also, before taping to the side of the face, I'm going to measure my extra tube, starting at the insertion site, all along the clear part of the tubing. That is about 46 centimeters, so I'll be sure to document that. And also taking a permanent marker, you will mark where the tubing stops so that the nurse knows where the tube should be placed. Place that above the stomach. And you're going to check the placement of the tube before sectioning and feeding every 4 hours using 2 different methods. You're going to provide oral care and also apply chapstick so that the lips do not have any breakdown. I'm going to perform hand hygiene and dispose of my materials. After placement is confirmed, you will suction and provide tubing or provide feeding as ordered. I'm going to perform hand hygiene. Make sure the patient's collar is within reach, bed is locked and lowered, patient is comfortable, and I'm going to document and report to the nurse.